Now, in the 2017 Ghana AIDS Commission report on HIV/AIDS infection shows an increase in new cases. The report also indicates that the Volta region and Brong-Ahafo region topped the chart of HIV/AIDS prevalence. The findings were revealed at the Commission's two-day annual strategic planning meeting. The Ghana AIDS Commission is therefore asking Ghanaians to be extra careful in order not to contract the disease. In studio with me to discuss this further is Treme Etiahene, Director, Research, Monitoring and Evaluation at the Ghana AIDS Commission. Thank you very much, sir, for your time.
Thank you and good morning.
Good morning. So, in the first place, what is the picture looking like? What's the rate of increase?
Right. I need to state that the report being cited here is incorrect. In the first place, we don't have 2017 report. We are going to produce 2017 report in March. So that report being cited is actually non-existent, which means that the figure quoted, which is 80% of new infections, increase in new infections by 80% is also incorrect.
Well, we haven't stated a figure as of now, but you have updated figures as of for this year?
Yeah.
For 2017 infection rates?
Before I come to that, I need to clarify for the benefit of the general public, because since we had the media briefing, different media organizations have put out different figures, none of which came from us. And it's caused quite amount of worry because it distorts the information we have on the HIV and AIDS epidemic in the country. And therefore, we need to, set the records straight. That first of all, there is no such report. And secondly, the 80% or 70%, which Finder also published, are incorrect. Now, this is a throwback from a December report done by Ghana Web, which misquoted the UN country director, saying that the UN country director said there had been increase in new infections in the country between 2010 and 2016 by 80%. That is not what she said. She said the increase in new infections between 2010 and 2016 was rather 18%. And so we are seeing the same thing being replayed now.
What you're saying is that there's an increased rate, but it's not up to the figure that is being reported.
Exactly.
So what's the figure? What's the rate of increase?
So the increase in new infections between the period I have mentioned is 18%. And that there is no suggestion that 18% is lower than 80% and therefore that is more comforting. No. It is a serious matter, even with 18% rise in the new infections, because that is what tells us the level of growth in the epidemic. And if we are seeing even 1% growth annually, and in this case, if we break it down, we are seeing 3% growth annually, which is even higher than the growth in the population, the population growth rate of the country. So it must be very worrying for us. However, government has put in place the right policies and strategies to address the problem.
But were we able to identify how the numbers went up?
Yes. If you read the DHS of 2014, DHS stands for Demographic and Health Survey of 2014, you know that the level of knowledge on HIV prevention has decreased. In fact, the report states that comprehensive knowledge of HIV prevention among women is only 18%, and that of men is only 30%. We also know that stigma is very high in the country, and stigma drives people who have HIV underground. It is, and that also shows that, you know, only 14% of men in the country, for example, would be happy to care for a relative who has HIV, or even buy food from somebody with HIV on the market. These are quite worrying. There are other reasons, for example, use of condoms during high-risk sex. When people meet and they have sex, casual sex, they don't protect themselves. That rate is also come down compared to the that of 2008. So there are a number of reasons that may account for the rise in new infections. But for me, generally, and which is more important, is the fact that Ghanaians have become generally complacent about HIV. Why? Because we are not seeing cases that used to scare everybody, because now we have treatment, and the treatment enables HIV clients or patients to live healthy lives. They live normal lives. So you hardly can see anybody who has AIDS in the country.
But isn't it also the case that the level of public awareness that was being raised some years back has gone down?
I will not dispute that, because that is a factor. That is an important factor, and that we are trying to address.
But why has that level of public education? We saw adverts in the past. We saw the Ghana AIDS Commission partner religious bodies actively advertising and educating the public. Why has that gone down?
We started off with huge donor interest as a country. We had funding from the World Bank, from UK aid, from Netherlands Embassy, from the UN system, European Union. Everybody supported us. But currently, we've lost most of our development partners. We have only Global Fund and the US government through PEPFAR. Unfortunately, Global Fund is only supporting treatment, antiretroviral treatment, prevention of mother-to-child transmission, key populations, and also providing HIV commodities like test kits, drugs, and condoms. So the general population, and it's about the same for the PEPFAR. So the general population is actually not taken care of under the funding that we have.
It's a matter of lack of money.
Exactly. So government has to take care of that. And fortunately, government is very committed in ensuring that we are able
that is
to.
Done.
So government has set up AIDS Fund, which would enable us raise domestic resources to support the AIDS response. So from this year, and in fact that was the reason for calling for the media briefing, to let them know the plans we have for the year and beyond.
Right, Mr. Tiahine, unfortunately we would have to end it here for the sake of time. Thank you very much for joining us. He's the head of research monitoring as the Ghana AIDS Commission, research monitoring and evaluation as the Ghana AIDS Commission chairman. Tiahine.